Well, it's Sunday, and it's becoming such a sort of part of the routine. I know you know what's going to happen now, as I say hello to David Ashford, the Minister for Health and Social Care. Mr. Ashford, obviously, I think my mailbox is going definitely one direction now, and that is completely about when this is going to come to an end, because you have definitely moved on, and if you kind of read the way you're saying things, and I'm talking about you and the Chief Minister, this is going to be now not a case of eradication, is it? We are literally going to move into the UK's open, we'll be open.
Yeah, things are moving on. We always said that once we'd got the vaccination done for the vulnerable, that opened up other possibilities for us, and that we need to move to a mitigation strategy rather than an elimination strategy. COVID is going to be around for a long, long time. An example I've used before is Spanish flu, that although there was a Spanish flu pandemic of 1918 through to 1921, Spanish flu was actually around till the mid-50s. So we've got to recognise that as a virus, COVID isn't going anywhere, and we've got to learn to live with it. But what's been important, and it goes back to those two principles we started off with a year ago, and sometimes it can be very hard to remember now because it's been so much has gone on. But the two key principles were preservation of life and preservation of the NHS to ensure our hospital didn't get overwhelmed. Once those two have been satisfied, then we can look at other options.
I mean, everything there is saying things are going in that direction. Now, at the same time, I mean, the biggest fan club the Chief Minister's had is people loving the borders being shut. They've loved it. But it has to happen, doesn't it? I mean, those people won't like it. Whatever happens, that we will have some cases of COVID in the community. It's just going to have to be part of the thing. But how do you sell that to those people who are so dead against it?
Well, I think the important thing is to have protection. And one of the other things we know about vaccines is they're not just very good at protecting life, they also minimise the symptoms of COVID. So certainly there's no evidence that people, for instance, who've had the vaccination end up with what we've been terming long COVID. So it seems to be very good at preventing that as well. And that's absolutely key, because it's not just around death, it's around long-term conditions that people can get. So as we vaccinate more and more of our population, then basically the risk decreases further. Now, there will be people who will be uncomfortable. There's been people who've been uncomfortable on both sides when we've brought restrictions in because we're restricting people's freedom and movement, and people on the other who believe, we should have stayed locked down longer. What we have to do is we have to get back to normal at some point, and that includes the borders as well. But it will be a phased approach. As I've said before to you, Paul, it's not going to be a big bang. You can't go from shut to open. We've got to ensure we do things in a steady progression based on the information that we have.
People are going to be looking at the UK, particularly Monday, the big day for them, coming up, when beer gardens will be in use, and normality in all sorts of ways with the hairdressers coming in, albeit there are restrictions. Suddenly we are behind this curve, and it's been quite bonkers to a lot of people. Remember, we had that long period of living normal life.
Yeah, I mean, we've actually been ahead of the UK and most countries in the world, to be perfectly frank, in the fact that we had a long period of normal life. And one of the reasons we brought this restrictions in for this circuit break lockdown is for us to be able to get back to that again as quickly as possible. So it has put us a week behind, but we have to put it into context that the UK has been living under these restrictions now for more than 12 months. And it's been horrendous for many people in our community when we were living under them last year for about four months, just over 4 months. The UK has been living under that for 3 times that. So although they are coming out, we have to bear in mind the context that here on Ireland, if you look at the whole period, we have fared an awful lot better.
Of course, every day we wait for the numbers to come out, and it was some time ago we had that unexplained case. It seems to have gone off the radar. It's never been sorted, and yet the medical advice was saying, it could be like the peat under, fire in the peat underground. It could come up. As time goes on, obviously things seem to go away, but that still was unexplained. You've never been able to tie it up, right?
Yeah, I mean, I've got to be careful what I talk about individual cases, but the thing with unexplained cases is you can have an unexplained case that you think maybe where it's come from. It's in an environment where there's been other cases, but you can't directly link how that person potentially caught it in that environment. So it still remains unexplained. You would only class it as explained if you can be absolutely certain you've got a direct link and transmission. In this particular case, while there may be certain it may have come from a certain environment where there may be in other cases, we can't establish that direct link, so therefore it remains unexplained. And that's a cautionary approach that we quite rightly take to ensure that, we don't just start dismissing things and saying, oh, they were in that environment, it must have come from there, and then it turns out they didn't. But as we move further away from that case and nothing else has been identified off the back of it, obviously it becomes more encouraging.
Well, for us in the Isle of Man, the school's going to be the big news, I suppose, isn't it? Getting them back up and running.
It is. Again, the UK has had issues with their schools, getting them back up and running. They were shut for a long period of time. It's important that children's education is disrupted as little as possible. There's been several periods of disruption now over the last 12 months. Again, we've had more education delivered than most other countries in the world over that period. But even so, we do need to get the children back into their learning environments as quickly as possible and as safely as possible.
And the UK allowing 2 tests a week, it's all free, you can get your kits sent to your house. I mean, I've mentioned these rapid tests numerous times, I get shot down every time because they're not reliable, but surely something's better than nothing, and we're not moving that direction?
We're not. It's a very expensive experiment, should we say, by the UK, and that's what it is. It is an experiment because there's no evidence from anywhere that this actually helps. The lateral flow testing, the technology is actually getting better with them, as you would expect as time moves on. So they are getting more accurate, but they are still quite hit and miss depending upon which ones you use. But equally, one of the interesting things that's emerged is they reckon that, even of people who show symptoms, about 47% don't come forward for testing, certainly within the UK. So if someone, for whatever reason that may be, maybe it's because they're worried that if they'll get about getting isolated, worried about their family getting locked down, worried about them not being able to earn maybe. But for whatever reason, so I'm not convinced that 2 tests a week will actually work, because the people who you may well be wanting to come forward may not be the ones who actually come forward. And we saw that with the mass testing programme around the UK as well, where the people who came forward were generally the people who were most concerned, but not necessarily the sample of the population that you wanted to be coming forward for those tests.
You were going to do a point-by-point rebuttal to Dr. Rachel Glovers' claims that she gave to the PAC. I haven't seen it yet. Has that come out, or where are we up to?
It's going to come out early next week now. As I said, I gave the staff time off over the Easter week and the week after Easter to recover from the work they've been doing over the last 12 months. Those staff are now back in work, and as a result, we'll be able to feed into the statement that the department will be putting out.
And will you yourself won't be giving evidence to PAC? I mean, how's it going to work?
They haven't asked us yet. As I've said, I mean, in the interest of fairness, I'm sure the PAC will call the department to give evidence. But to my knowledge, an actual evidence session hasn't been. They've asked for various documentation, I believe, but they haven't actually called for an evidence session yet.
Would you like that opportunity to put your side directly? Because obviously you're covered anyway as well. But otherwise, it all gets involved with lawyers, doesn't it?
Yeah, I mean, I would be content for the department to give evidence. I always am with parliamentary committees. The parliamentary committees serve a very valuable purpose, and they should be utilised. In terms of the other side, as I say, that's best left to the legal professionals.
Now, that picture that was taken, the Manx Care photo, where 8 were in vision, one obviously was taking it, you said it yourself, it was not the best idea to have done it. The fact is, people kind of can't quite think of a reason that why you'd have to actually physically meet up in person for a meeting when you could do it remotely. Can you put any more information that it had to be done in person?
Things, for instance, around patient safety discussions, particular patient discussions that have to take place face to face because of the risk of miscommunication under any other form of method. All of the people are essential workers, so there is no regulations that have been breached. They do all need to be in the workplace. The angle of the photo I find quite interesting, actually, because I know that room very well. It's the boardroom up at Nobles. I've been in there many, many times, and it's an absolutely massive room if you're ever in it, Paul.
I have, yes, I've seen it.
Yeah. So you'll know firsthand then. But somehow, bizarrely, the angle that photo's been taken from, it looks like they're all in a storage closet, to be perfectly frank. So they managed to probably take it from the worst angle. They are all socially distanced in the photo. That boardroom table can sit about 18 people in normal times, and probably 9 to 10 socially distanced. PPE was in use. I was perfectly honest at the press conference, and I'll be honest again. Was it great timing to put that photo out? Probably not, to be honest. It wouldn't have been my choice of timing, but I think it was done in all innocence, in a valid way. It was the first meeting in those circumstances of Manx Care, and they wanted to get the message out to the public that Manx Care was up and running.
And if I can just add in, sometimes it's best to leave things up. When you pull them off, it makes things doubly worse almost, because people then see something, it's been pulled, why is it being pulled? If you've done it, you might as well just stay with it. But you can't win, can you?
But like I say, in defence of Manx Care, all the people did need to be in work. The meeting did need to go ahead. And the photo that was taken socially distanced, and all those people were using appropriate PPE.
Okay. I'm going to run some pictures now, which I've got in since doing the interview, an update with Sue Blythe and her husband. I think you probably know the story. It's been getting massive traction about having to comply with the law. She went away to pick up a puppy, came back, couldn't get picked up by her husband, had to take a taxi. He had to move into the motorhome. So since then, part 2 of this is, and following the letter of the law, they both got on the boat, although he had to go down separately to her. Got on the boat, then they could be together in a cabin. This is what we're looking at now with their beautiful little puppy. Went over, literally, because they did. They've now come straight back on the next sailing, and they're now legally okay to cohabit together in their quarantine period. I mean, what do you think?
Well, what we've got to do is we've got to look at while the rule was in place. It is correct that anyone that has travelled cannot return to an occupied house with someone who hasn't travelled. That was brought in at the end of December, start of January. Because of the issue with the new Kent variant and the way that it transmits through households. We have seen much more households spread over this period. The risk, of course, is that people are on different cycles of incubation if they're coming back into an infected house, because you don't know when the person who's travelled actually was infected, even if they tested positive. So basically, there is the risk of it going into the household. Even if you tested the household, because they're on an early period of incubation, they could pass the test and then be released. So what you've got to be very careful of at the moment with the Kent variant is this. So that is why the rule was in. And that is why the rule at the moment is staying. This is something that will have to be reviewed over coming weeks as well, around whether it is still practical to have people coming back into properties and then forcing other family member to isolate elsewhere, or indeed them isolate elsewhere. But at the moment, that is the law in place, and there is no one who can grant an exemption to that. The only exemption to that is for those with patient transfer or in need of care, where a medical professional can certify they need care in the home, and at that point the whole household isolates together. But that still carries risk.
Would you say, though, it was unfortunate that 111 gave information out and it wasn't correct? And interestingly, which you won't know this fact, she's asked for a copy of that. They know the call was made, but they've lost the actual audio tape, because everything gets taped. Anyway, that's by the by. But do you regret that the information can't be better handled to get it on message?
Well, most definitely. If incorrect information has gone out, then most definitely, people rely on the information that they're given. And if there's any confusion in that regard, although 111 isn't part of DHSC, I'm still personally willing to apologise for that, because people do rely on that information being accurate, because they base their travel plans and what they're going to do when they return to the island on that information. But unfortunately, the law is the law in place, and people, including myself as a minister, can't exempt people from the law. And
there's quite a serious allegation about the way that the lady was treated on her return. Vexatious, potentially, I don't know how strong to use, but certainly got a hard time, because met by 5 security officers, and the police were threatened to be called, and all sorts of things. Maybe that can be looked at, do you think? The way
I believe it is being looked at, Paul.
Right. Well, we are now sort of getting ready for another press conference on Monday. Are we going to have big announcements this week? I mean, obviously there is going to be restrictions lifted at some point. Are we expecting this to be told by you tomorrow, or are we waiting to the Thursday press conference, or what now?
Any major changes would be Thursday, because the next set of changes only come in as of tomorrow. So as you know, we don't start piling things on top of one another. Same as last year, we take it in stages. So any major decisions would be announced on next Thursday. In terms of tomorrow, the new releases come in then. At the moment, to be honest, there's not an awful lot to say. It's quite all quiet on the Western Front, as they say, at the moment, at the current time, which is a good thing. So there's nothing spectacular at the moment to come out of the hat. But as we know with this virus, things happen at very short notice. And but at the moment there is nothing new to communicate.
Okay, and one thing we touch on all the time is about how is Nobles doing, because I keep getting stories, the staffing. You kind of alluded to that. You've had to have bank staff in, that sort of thing. Is that getting better now, or where are we up to?
It is easing off, as you've seen from the figures. There's only the one person in the hospital, so it has eased away the pressure. I'd like to thank all of the staff because they were really under the pump, both from a mixture, in fact, a perfect storm, to be perfectly honest, of rising hospital numbers, rising ICU numbers, and at the same time a large bank of staff either isolated because they were close contacts of cases identified, or the fact that they didn't have childcare when the schools were shut. So for all the staff across health and social care, a big thank you from me. They managed to keep the system running under extreme pressure.
And the fallout from the vaccine situation and the blood clots and that sort of thing, we kind of covered that on Thursday, but it's not going away. I'm talking to a lot of people who literally don't want to have their second jab even, and yet they've got no other options because you're not allowing people to mix them anyway, as far as I'm aware.
You can't legally mix them.
Right, but there's that uncertainty now, which must be a worry, isn't it? Is that...
Well, I need to be very clear again. People should still go forward and have the AstraZeneca jab. I'll use the words of the chairman of the JCVI, who is an awful lot more qualified in this area than I am. They have been looking at this in depth, as have the MHRA and also the European Medicals Agency. The chair of the JCVI said they are recommending for under 30s an alternative jab be used and these are his words, out of an abundance of caution, not because they are concerned about the safety of the jab. Now, that was his exact words. And the other key thing is that is not saying that under 30 should not have the AstraZeneca jab. It is saying if there is an alternative available, then they should be offered that. But if there isn't an alternative available, they should still have the AstraZeneca jab. We have to, again, look at the stats around these. Even if we take into account all of the cases that have been identified worldwide, so not just looking at the UK, the chances of this occurring is 4 in a million. You have more chance of developing one of these types of clots taking the contraceptive pill, to put it into context again, or developing one of these types of clots by actually going on a long-haul flight. So that just puts into context where it is, whereas also COVID itself causes clotting. So if you catch COVID, you have a 1 in 100 chance that you will actually have some form of stroke. If you contract COVID, you have an 11 in 100 chance that you will develop DVTs within your legs. And also this particular type of clot, you have roughly with COVID around about a 5 in 100 chance of this happening. So that just puts context around it. Nothing is free without risk because we are all unique as human beings and people react differently. But what I would also say to those who have had their first jab, again, looking at cases around the world with the CSTV clots, not one case of it has been identified after second jab. They have all developed from people having the first jab and in between them having the second. So the absolute advice by every single medical agency around the world is if someone has had their first jab, then they should also have their second.
Presumably other vaccines also have side effects. I mean, that's part of the thing. You say that every drug has a side effect, doesn't it, of some description?
They do, and there's recorded side effects for Pfizer as well, and other vaccines. The flu vaccine, for instance, Guillain-Barré syndrome is known to be caused by the flu vaccine in some cases, which is a nervous condition that is quite extreme. But but the risk of not having the vaccine and contracting COVID is much higher. In fact, one of the interesting things that has come out of the recent studies is even amongst young people who contract COVID, about 10% of them end up with long COVID. So a 1 in 10 chance, even if you're a young person, if you end up with COVID, that you could actually end up with long-term health effects as a result. So
the final word on this is go, have it done, be prepared though, and listen to what they say, because I still can't get that. I mean, some people seem surprised having the side effects. When I had it done, it was clearly laid out to me exactly the potential that you might have X, Y or Z happen to you.
Yes, your immune system will react to the vaccine. That's the whole point.
That's good news, isn't it? To have a sort of reaction.
It's to train the immune system. The point of the vaccine is to train the immune system to fight the spike protein of the virus. Should the virus end up, that basically your immune system, which is your army, should we say, in the body, recognises that is an invader and the enemy, and will take it out at the earliest opportunity.
And to finish with, have you been called up yet? Have you had one?
I have. I'm due to have my vaccine tomorrow.
Oh, right. Do you know which one you're getting, or do you want to say that?
I do, because it's on the letter. I don't get a choice either as to which one I have. Mine is the Pfizer vaccine that I will be having. So you've actually, between the Chief Minister and me, got two people on the podium that have tried and tested both vaccines.
And final, how's the supply issue looking at the minute?
So next week, people will see a drop in the number of people vaccinated. That is what we'd already spoken about. If you remember, middle of May was when we were going to see the drop-off. So we will see that drop-off next week, and possibly into the start of the following week as well, before the numbers pick up again. That's nothing for people to be concerned about. That is exactly what we spoke about when we said that we were expecting some supply disruption in the middle of April.
And the new vaccine, has that come online yet, or is it in the pipeline still?
It's in the pipeline still. We would expect, hopefully, in the next few weeks that Moderna will be signed off, the indemnity will be in place, and supplies will be available to the island.